National Preparedness Month webinar, Disaster and Emergency Planning. National Preparedness Month. September is National Preparedness Month, and we should encourage first responders and their families to make a commitment to prepare for emergencies by following 3 simple steps. 1. Be informed before, during, and after an emergency. 2. Make a family emergency plan. 3. Get an emergency supply kit. Disaster and emergency planning. Today we will go over disaster and emergency planning. In order to keep families safe in an emergency, it is important to plan in advance. Here are some suggested guidelines to follow. 1. Find out what type of hazards are most likely in your area. 2. Create a family disaster plan. 3. Create and complete a checklist. 4. Practice and maintain your plan. 5. Emergency preparedness tips for vulnerable populations. 6. Include pet preparedness in your emergency planning. 1. Find out what could happen in your area. Contact your local officials, local health department, and American Red Cross chapter. Be prepared to take notes. Ask what types of disasters could happen. Ask about animal care after disasters. Animals may not be allowed inside emergency shelters due to health regulations. Find out how to help elderly or disabled persons. Find out about the disaster plans at your workplace, your children's school or daycare center, and other places your family spends time. Contact local officials in your area to find out what types of disaster could happen. Here are some local officials you could contact to find out disaster and emergency planning information for your area. Illinois Department of Public Health, local health departments in most counties. Each county has a certified health department. American Red Cross, City Mayor, District Alderman, State Emergency Management Agency, local Emergency Management Agency contacts. You can locate emergency management services in each county. A local health department develops and administers programs and services that are aimed at maintaining a healthy community. In disaster and emergency preparedness planning, your local health department is responsible for the coordination of all health-related responses to emergencies. Local health departments have a Public Health Emergency Preparedness program that develops plans for the coordination of all health-related responses to natural man-made emergencies or disasters to include acts of terrorism, mass dispensing of medication and vaccinations, conducting professional workforce training, facilitating and participating in emergency preparedness exercises and drills, preparedness activities in collaboration with municipal, county, and state agencies, as well as local emergency management agencies and community-based organizations such as Medical Reserve Corps units and Illinois Helps volunteer management system. FEP staff are experienced in emergency preparedness. They consist of staff specialists in environmental health, disease control, nursing, incident command, and hazardous materials. Local health departments respond to chemical emergencies, biological emergencies, physical emergencies. Local health departments perform communicable diseases prevention, immunizations, environmental investigations, public health surveillance and epidemiologic investigations, information sharing. How do I contact my local health department in Illinois? The Illinois Department of Public Health provides an alphabetical list of local health departments on their website. The information includes locations, office, and fax numbers. Along with Internet services, you may contact the main number of the Illinois Department of Public Health at 217-782-4977 and ask for assistance locating the local health department in your area. TTY number 800-547-0466. The American Red Cross exists to provide compassionate care to those in need. Their network of donors, volunteers, and employees share a mission of preventing and relieving suffering here at home and around the world through 5 key service areas. 1. Disaster relief. 2. Supporting America's military families. 3. Life-saving blood. 4. Health and safety services. 5. International services. How do I contact the American Red Cross during a disaster or emergency? If you are in need of immediate assistance, contact your local American Red Cross on their website. The American Red Cross offers assistive technology for people who have trouble typing, using a mouse or reading a website. You may also call 1-800-RED CROSS for assistance or contact the National Headquarters Staff Director at 202-303-5214. Get assistance during a disaster or emergency. If you have access to the Internet, contact the Red Cross on their website or call 1-800-RED-CROSS. The website provides tools to assist disaster victims with locating safe shelter, hot meals, essential relief supplies, emotional support, and health services like first aid. Here are a few of the tools. Find an open shelter, register or search the safe and well listings, disaster recovery guides. To find out more about what the American Red Cross has to offer, please visit their website. 2. Create a family disaster and emergency plan. Meet with your family and talk about why you need to prepare for a disaster. Explain the dangers of fire, severe weather, and earthquakes to children. Plan to share responsibilities and work together as a team. Discuss the types of disasters that could happen and what to do. Pick 2 places to meet, right outside your home, outside your neighborhood, in case you cannot return home. Make sure everyone knows the address and phone number of the place where you plan to meet. Ask an out-of-state family member to be your family contact. All family members should call this person and tell them where they are. Talk about what to do in an evacuation. Plan how to take care of your pets. Remember, the best emergency plans are those with very few details. 3. Create and complete a checklist. Keep emergency telephone numbers by phones and add them as a contact on cell phones. Teach children how and when to call 911. Show each family member how and when to turn off the water, gas, and electricity. Check if you have adequate insurance coverage. Install a smoke detector on each level of your home, especially near bedrooms. Teach each family member how to use the fire extinguisher and show them where it is kept. Contact your local fire department to learn more about home fire hazards. Look around your home for possible hazards. During a disaster, ordinary objects in your home can cause injury or damage. Anything that can move, fall, break, or cause a fire is a home hazard. For example, a hot water heater or a bookshelf can fall. Inspect your home at least once a year and fix potential hazards. Stock emergency supplies and assemble an emergency supply kit. Take a Red Cross first aid and CPR class. Determine the best escape routes from your home. Find 2 ways out of each room. Find the safe spots in your home for each type of disaster. Keep a smaller disaster supplies kit in the trunk of your car. Keep a portable, battery-operated radio or television and extra batteries. Make 2 photocopies of vital documents or scan to a USB flash drive and keep the originals and flash drive in a safe deposit box and give the second copy to an out-of-town friend or relative. Always keep a supply of extra batteries. Take a complete inventory of your home, garage, and surrounding property. This could help you prove the value of what you owned if your possessions are damaged or destroyed, and can help you to claim deductions on taxes. 4. Practice and maintain your plan. Quiz your kids every 6 months so they remember what to do. Conduct fire and emergency evacuation drills. Replace stored water every 3 months and stored food every 6 months. Test and recharge your fire extinguishers according to manufacturer's instructions. Test your smoke detectors monthly and change the batteries at least once a year. 5. Emergency preparedness tips for vulnerable populations. If you have a disability or an access and functional need, the benefits for preparedness are saving lives, preventing injuries, helping maintain independence, reducing chaos, building personal confidence. If you have a disability or an access and functional need, you may need to take additional steps to prepare for emergencies. Stock a basic disaster supply kit. Inventory what you use every day to live independently. Stock custom essentials in your kit, such as durable medical equipment, assistive technology, food for special diets, prescription medicines, diabetic supplies, hearing aids and batteries, a TTY, manual wheelchair, and supplies for a service animal. Plan to stay independent during times when services may be unavailable during an emergency. Create a support network. Plan how you will contact family members by calling or emailing or texting agreed-upon friends or relatives if you are unable to contact each other directly. Socialize your emergency plans. Tell your support network where you keep your emergency supplies so they may be able to assist you with your assistive devices if you need to evacuate your home. If you use oxygen or other medical equipment, show your support network these devices so they can move you or help you evacuate. Practice your plan. Discuss assistance you may need with your employer in the event of an emergency. Create a plan and share it with all in your support network so they know what you need and how to contact you if the power goes out. Collect important information and phone numbers. Keep a list of contacts, including family and friends, and list the best way to reach them in an emergency. Keep a list of the local nonprofit or community-based organizations that could provide assistance. Maintain a list of phone numbers for your doctors, pharmacy, and the medical facilities you use. Make copies of medical prescriptions and doctor's orders for assisted devices that you use. List where you got the devices from and see if your local pharmacy is willing to provide a list of your prescription medicine and devices for you. Make copies of medical insurance cards, Medicare or Medicaid cards, physician's contact information, a list of your allergies, and your health history. Even if you do not use a computer, put important information onto a flash drive for easy transport in the event of an evacuation. If you own a medical alert tag or bracelet, wear it. Keep track of which TV stations broadcast news that is captioned or signed. Find out if your community has a public warning system, and if so, what the warning sounds like. When traveling or in an unfamiliar area, know what type of alert and warning services are used and where to find them. If you receive dialysis or other life-sustaining medical treatment, identify the location and availability of more than one facility and work with your provider to develop your personal emergency plan. Make backup plans to receive medical treatment. If you work with a medical provider or organization to receive life-sustaining medical treatment, such as dialysis, oxygen, or cancer treatment, work with the provider to identify alternative locations where you could continue to receive treatment. Make backup plans to receive in-home care. If you receive in-home assistance or personal assistance services, work with your agency and develop a backup plan for continued care. Ask how you can continue to receive services from providers such as a Center for Independent Living, Meals on Wheels, or medical and life alert services. Stay mobile with accessible transportation. Plan ahead for accessible transportation that you may need for evacuation or getting to a medical clinic. Work with local services such as Older Adults Transportation Service, OATS, to identify your local or private accessible service. Plan for possible evacuation. During an emergency, be ready to explain to first responders and emergency officials that you need to evacuate and choose to go to a shelter with your family, service animal, caregiver, personal assistant, and your assistive technology devices. Note that people should only be referred to a medical shelter when they have acute health care needs and would typically be admitted to a hospital. Plan for power outages before they happen. Before disaster strikes, you may register with your power company. They may alert you when power will be restored in an unplanned outage and before a planned outage. In the event that you cannot be without power, plan for how you will have power back up. If possible, have backup battery, generator, or alternate electrical resources. Make sure that devices that will maintain power to your equipment during electrical outages are charged. Purchase extra batteries for motorized wheelchairs or other battery-operated medical or assistive technology devices. Keep the batteries charged at all times. Consider whether you could charge your wheelchair from your car. Backup chargers for a cell phone could include a hand crank USB cell phone emergency charger, a solar charger, or a battery pack. Some weather radios have a built-in hand crank charger. Backup chargers for a laptop or tablet could include a 12-volt USB adapter that plugs into a car, an inverter, or a battery jump pack with an USB port. People who are deaf or hard of hearing can get important information on a cell phone or pager. Sign up for emergency emails and text messages on your cell phone from your local government alert system. Plan how you are going to receive emergency information if you're unable to use a TV, radio, or computer. This may include having an adaptive weather alert system to alert you in the event of severe weather. Plan for medications that require refrigeration. Having flashlights available will also facilitate lip reading or signing in the dark. Deaf or hearing loss. Extra batteries and a spare charger for hearing aids and/or personal assistive listening device. Keep records of where you got your hearing aids and exact type of batteries. Consider how you are going to receive emergency information if you are unable to use a TV, radio, or computer. Use a NOAA weather radio for deaf and hard of hearing that has an adaptive weather alert system. Many new cell phones and smartphones have an alerting capability that includes specific sounds and vibrations that can be set to signal users of an emergency. Keep a TTY as part of your emergency supply kit. Keep a pen and paper in case you have to communicate with someone who does not understand American Sign Language. Write an explanation of your needs in advance. If you need an assistive device or an interpreter, write it down. For example, I use an American Sign Language. I have a hearing loss and I need an interpreter. I need my TTY. Blind or vision loss. Write down on a sheet of paper what your needs are. If you need an assisted device or service animal, include it on the paper. For example, I am blind and I need my service dog, or I am deaf, blind, and I use a Braille TTY to communicate. Keep Braille communication cards if used. Mark emergency supplies with Braille labels. Keep a list of your emergency supplies on a portable flash drive or make an audio file that is kept in a safe place where you can access it. Keep a Braille TTY as part of your emergency supply kit. Have an extra mobility cane if used. Speech disability. If you have a speech disability, consider carrying an animated personal communication board if you might need assistance being understood. This could be one or several 3x5-inch cards containing written messages. Mobility disability. If you use a motorized wheelchair, if possible, have a lightweight manual chair available as a backup. Know the size and weight of your wheelchair in addition to whether or not it is collapsible in case it has to be transported. Purchase an extra battery for a motorized wheelchair or other battery-operated medical or assistive technology devices. If you are unable to purchase an extra battery, find out what agencies, organizations, or local charitable groups can help you with the purchase. Consider keeping a patch kit or can of sealant for flat tires and/or extra inner tube if wheelchair or scooter is not puncture-proof. Extra mobility cane or walker if you use one. Specialized medications and supplies. If possible, stock extra over-the-counter and prescription medicine, oxygen, insulin, catheters, or other medical supplies you use. Keep medical alert tags or bracelets or written descriptions of your disability and support needs in case you're unable to describe the situation in an emergency. Make copies of medical prescriptions, doctor's orders, and the style and serial numbers of the support devices you use. Service animals. Make plans in advance for your service animal in the event that you stay at home or you evacuate. Stock food, water, and medications. Also have identification, licenses, and a favorite toy for your service animal. If you go to a public shelter, by law, all service animals are allowed inside, but no other animals are allowed in public shelters. Plan for someone else to take care of your service animal if you are not able to following a disaster. 6. Pet Preparedness. Your plan should include all family members. The best way to protect your household from the effects of a disaster is to have a disaster plan. If you are a pet owner, that plan must include your pets. Being prepared can save their lives. In the event of a disaster, if you must evacuate, the most important thing you can do to protect your pets is to evacuate them too. If it's not safe for you to stay behind, then it's not safe to leave pets behind either. Take action now so you know how to best care for your furry friends when the unexpected occurs. Know a safe place to take your pets. Local and state health and safety regulations only permit the Red Cross to allow service animals in Red Cross disaster shelters. Contact hotels and motels outside your local area to check their policies on accepting pets and restrictions on number, size, and species. Ask if no pet policies can be waived in an emergency. Keep a list of pet-friendly places, including phone numbers with your disaster supplies. Ask friends, relatives, or others outside the affected area whether they could shelter your animals. Make a list of boarding facilities and veterinarians who could shelter animals in an emergency. Include 24-hour phone numbers. Ask local animal shelters if they provide emergency shelter or foster care for pets during a disaster. Assemble a pet emergency preparedness kit. Keep your pet's essential supplies in sturdy containers that can be easily accessed and carried. Pet emergency kits should include medications and medical records stored in a waterproof container and a first aid kit, sturdy leashes, harnesses, and/or carriers to transport pets safely and ensure that your animals can't escape, current photos of your pets in case they get lost, food, drinkable water, bowls, cat litter and pan, and manual can opener, feeding schedules, medical conditions, behavior problems, and the name and number of your veterinarian in case you have to foster or board your pets, pet better toys if easily transportable. Help emergency workers help your pets. The ASPCA recommends using a rescue sticker alert to let people know that pets are inside your home. Make sure it is visible to rescue workers and that it includes the types and number of pets in your household and your veterinarian's phone number. If you must evacuate with your pets, and if time allows, write "evacuated" across the stickers so rescue workers don't waste time looking for them. In closing, here is a summary of what we reviewed. It is important to contact local officials to find out what hazards are most likely to happen in your area, how to contact your local health department and American Red Cross, and what assistance they provide. Meet with your family to create a family disaster and emergency plan. Create and complete a checklist, and practice and maintain your plan. Emergency preparedness tips for vulnerable populations. Pet preparedness tips. Remember, emergency preparedness starts with you. Plan, prepare, train. Be ready when the time comes. Please check out all of the webinars the Illinois Department of Public Health Office of Preparedness and Response is offering to support awareness of National Preparedness Month in September. They include Be Informed and Stay Informed during and after an emergency, Prepare an Emergency Supply Kit, Prepare for a Flood and Tornado, and the one you just listened to, Disaster and Emergency Planning. This concludes your presentation.